Hi, my name is Mellissa Ward, and I am the nursing student doing the cardiovascular exam today. And here's my badge, my ID. And we'll go ahead and look. I've got my measuring tape, my straight angle. I've got just a light. My patient. We're just going to scan the room. Try to do this. Not the easiest, so. All right. So, hi, my name is Mellissa. I am the nursing student doing your exam. I'm going to start by inspecting the fraternal jugular vein with my tangial light. If you could just turn your head towards me and then away. All right, and then back towards me. I'm just looking for that pulsation, and I'm actually going to find the angle of Louis, which is where the membrane and the sternal body come together. And I'm going to go across. If you could turn towards me. I'm going to measure across and then up. Perfect. And it's about 2 centimeters, which is completely normal. And so while I'm here, I'm going to go ahead and I'm going to palpate your carotid. Okay. Perfect. It's a smooth, rate is regular, and we'll go ahead and move down. So I'm going to go ahead and palpate and identify all of the locations. So starting with the angle of Louis, again here, and to her right in the intercostal space is going to be the aortic area, and then to the left intercostal is going to be pulmonic. And we'll step down to the third intercostal on the left, and that's going to be Erb's point. And then the fourth is going to be the tricuspid, and then fifth, and then midclavicular. And follow it down. And this is going to be for the mitral valve, and also point of maximal impulse. I'm going to just pull up here so I can just look and inspect. And I'm also going to go ahead and palpate. Perfect. And so I can actually feel the pulsation there at the point of maximal impulse. If I couldn't, I would have her turn on her left decubitus side to do so. So I'm going to go ahead and use the bell to auscultate the carotids for bruits. If you could exhale and then hold your breath. Exhale. And then hold. Okay. And then exhale. And hold. Perfect. So I'm going to go ahead and use the diaphragm, and I'm going to go ahead and auscultate all of each point, the aortic and the pulmonic, tricuspid, and then at the mitral valve. And that's Erb's point. I'm going to go down one more to tricuspid. And one down. I'm going to follow it along. Perfect. So Rate and rhythm are normal. Go ahead and I'm going to use my bell. Perfect. So rate and rhythm are both normal. S1, S2 are heard. No S3, S4s, murmurs, clicks, or rubs, which is good because so I'm not hearing anything abnormal with the heart sounds. So what I am going to do is have you go ahead and turn on your left side, and I'm going to use my bell, and I'm just going to be listening at that point of maximal impulse actually for mitral stenosis, so murmur or S3, S4. Perfect. So no rubs, clicks, murmurs, nothing abnormal there. And then what I'll have you do is have you just sit forward, and I'm gonna have you sit on the edge of the bed here, and I'm actually gonna have you just actually lean forward with this one, and I'm gonna listen at the aortic spot, and I'm gonna have you exhale and hold. Perfect. All right, and no rubs, clicks. If you could just go ahead and lay back down, I'm going to actually do the point of maximal impulse. If you could go left decubitus towards me again. So this time I'm going to have you exhale and hold your breath. Perfect. Again, no abnormal sounds there. So we'll go ahead and move on, and I'm going to inspect the arms. So bilaterally, they are pink and warm to touch, and it doesn't appear to have any bruising, swelling, does have a tattoo, but no ulcerations, anything abnormal. So nail beds are pink. I'm gonna go ahead and check capillary refill, holding for 5 seconds. Perfect. And refill is brisk, it's immediate on left and on right. And I'm going to go ahead and check for edema, and I'm going to hold for 10 seconds and release, and no edema. So now I'm going to go ahead and do the brachial pulse, and it's smooth, regular, grade 2 plus, and brachial, or radial, excuse me. Perfect, and it's smooth. Rate is normal. Rhythm is normal. I'm gonna go ahead and check your lymph nodes. I'm just gonna have you rest your arm in my, just the inner aspect here. I'm not able to palpate the lymph nodes. I'm gonna go ahead and do the same thing here. Start with your radial. Brachial. Perfect. So grade 2 plus on all of the upper extremities. I'm going to go ahead and check the lymph nodes. And just rest it down here. All right. And so lymph nodes are not palpable. So I'm going to go ahead and move down to the legs, and I'm just going to make sure that they're in the camera here. And so legs, looking for edema, swelling, which there is no edema or swelling. They are equal. The toes are painted, so it's a little harder, but we would hold, looks like the nail beds are pink at the base of the nail polish, and I can actually see the return, the capillary return is brisk at the base of the nail that's not painted. Holding for 5 seconds and releasing. Okay, and that's good. And I'm going to go ahead and check the dorsal pedialis pulse. Perfect, and that's a grade 2, smooth. Rates regular. And the posterior tibialis. Perfect. Grade 2 plus. I'm going to go ahead and do the popliteal. Let's have you relax here. Perfect. That one's also a grade 2. And that is a grade 2. All right, so I'm just gonna slide the side so I can do your femoral. It's a grade 2 plus. Grade 2 plus, and I'm just gonna do and look for nodes, the inguinal lymph nodes. Sorry, a little ticklish. So I'm not able to palpate the inguinal nodes. I'm going to go ahead and do the Allen's test. So legs look good. She does have some scarring to the left upper thigh. No abnormality. The color is pink. Temperature is warm. No pitting edema. We'll go ahead and check 10 seconds. 1, 2. And perfect. So yeah, no pitting edema. No abnormalities noted. The blood flow is good. So we'll go ahead and do the Allen's test, and I'm going to have you pump your hand while I occlude 5 times. You're gonna open your hand. Perfect. Blood return is immediate and brisk. Go ahead and do it again. Perfect, and blood return is immediate. Immediate. Perfect, blood return is immediate. So now for this one, to check for arterial insufficiency in the legs, we're gonna hold your legs up to that 60-degree angle and just allow for the blood flow to come out until they start to look pale, which they were already a little pale, but perfect. And then I'm gonna have you just turn to the side to dangle. Perfect, I think we're there. Ready? All right. So, perfect. So you did get that color back, and that was within the minute. So no arterial insufficiency. So that concludes our exam.